Okay, so I think we'll start. Like to wish you all good morning. I hope you enjoyed the previous session. It was very exciting. You'll be pleased to hear that I will not be rapping for my presentation. I'll do it in a slightly more traditional way. I'd like to start by introducing ourselves. We're the Child Health Initiative. We're a collection of global organisations working on the ground in many countries around the world, and we are focusing on some of the biggest challenges to older children, adolescents worldwide in particular, and we're focusing on school-age children. I'd like to start by asking you all a question and see if we get any answers. What's the biggest killer of school-age children, of children over the age of 10 worldwide? Any ideas? What would be the big killers of children over the age of 10? Labour. In what sense? Child labour, a big threat to children, yeah. Child labour undoubtedly is a huge... Disease. Yeah, communicable diseases. Yeah. Any more? Access to water, clean water, and probably malnutrition with that as well as a major, yeah. I'm going to show you a slide now on the main killers of children over the age of 10 globally. And what we can see here is that under fives, where there's huge threats to children, there's been a lot of work in the development community that I'm sure many of you are involved with. Very important work on malaria, on diarrhea, malnutrition, that are huge threats to children under the age of 5 and over 5 as well. As children get over the age of 10, what we see here is this big threat to children growing, road traffic injury, moving up to become the leading killer of children. This is for developing countries, this slide. If I had a slide on developed countries as well, it would be a similar situation with road traffic injury, but obviously HIV/AIDS, it would be more self-harm and interpersonal violence that we're looking at for more developed countries. But it's the same situation globally with these major threats to children. And obviously the issues of clean water and malnutrition, as you're focusing on, incredibly important issues. This is an issue, road traffic injury, that isn't being addressed, or hasn't been in the past addressed so much by the development community. And I'd like to tell you a little story of a little girl in Dar es Salaam. This is her. This is Celia Chibulungi from Mbuyuni in Dar es Salaam. She's from one of the poorest neighborhoods of Dar es Salaam. Her family, she's looked after by her grandmother. Her father is unemployed, her mother's not around. It's a very typical story of many of the children that we see in cities in sub-Saharan Africa, in developing countries worldwide. Her family earns about $2 a day. She faces many of the challenges that I know many of you are working on. This is the school she goes to in Mbuyuni. The children here, under 5, there's been a lot of work and a lot of effort that has been placed into sanitation and poverty. There's a lot more that needs to be done for them, and a hell of a lot more that needs to be done on these issues. Over the age of 10, as I say, the biggest threat that increasingly they're facing every day is from road traffic injury, on top of the poverty that they're also facing as well. So for Celia, she was going to school about 18 months ago, walking on the side of the road, and she was hit by a speeding vehicle, and she suffered head injuries. She missed a significant amount of school. Her family had to spend 5 times the monthly salary on healthcare following her injuries. So effectively her family were plunged much further into poverty as a result of this taking place. And this was just Celia doing what she should be doing, trying to get to school in the morning, walking by the side of the road in Dar es Salaam. I'm going to hand over to a couple of colleagues of mine who have been working both in Dar es Salaam and around other cities in sub-Saharan Africa. They've been working in cities like Lusaka, and they're going to take you through what they've been doing to respond to this situation in cities like Lusaka. So I'll pass you on to Julio Sura, who's from the International Road Assessment Program, working in over 80 countries. Julio's from Chile, from Santiago. And Simon Kalolo, who's from Dar es Salaam itself and is working with Julio, has been working around the world with him, including in Lusaka. So I'll pass you on to these two now.
Thank you, Avi. So, as you mentioned before, the case of this little girl, right, in an African community, can be the case of any of the kids that go to this school that we see here. This is a school called Justin Kabwe School in Lusaka, Zambia. So for you to have an idea where this school is located, I'm going to show you here this slide. So here you can see clearly that this school is in the area there in the picture. Very, very dense area in Lusaka. So you can see that the school is surrounded by a residential area. And the picture that we were seeing before is just this intersection that is in the circle. So the circle that you see there corresponds to exactly this point. So Avi was mentioning before that road injuries are one of the biggest killers of children, and especially on the way to schools. So I'm also going to ask you a question. What's wrong in this place? Do you think that this is a good road environment? Is it a safe road environment for children? For you to have an idea before you answer the question, just on this main street, which is the entrance to the school, on the main street, you see 3 or 4 kids that are crossing. On a peak hour in the morning and in the afternoons, more than 900 children cross that street. 900. And you know how many vehicles go on this street? More than 4,000 vehicles every day go on that street. At what speed? At 60 kilometers per hour on average. So now the question, do you think that this is okay? Who thinks that it's an okay environment? Nobody. Okay, so what are the main problems here? Just one idea. Doesn't have a zebra crossing, okay? Okay, so that would make the environment safer, right? Anyone else? Signs, yeah, doesn't have signs, okay. Yeah, go ahead. Yeah. You want to make the presentation? So who else? Lighting is poor. Okay, so let's take a look. First of all, exactly, when you mentioned zebra, why do we need something like a zebra? Because clearly here, in this situation, the pedestrians are unprotected. They are not protected. Why pedestrians need protection? Because they are vulnerable users. They are not cars, right? They don't have a protection. So when you're a user that is vulnerable user, you need protection. So there are no protection at all. You see here people that are crossing without any signalization, nothing. And also you see people that are just by the carriageway, very near to the carriageway, because there is no any clear division between the carriageway and the path. So what else we have here? There are vehicles encroaching on pedestrian space. And also, we have, as I said before, some high-speed volumes. So I'm going to pass the word to my colleague, Simon, who is maybe going to comment on this one, and then go to the next slide, right?
All right, thank you, Julia. And before I proceed, do you want to talk about the app? You? Yeah. Oh, very good. So, quite interesting. We saw the statistics from Avi when he started with his slide, and what actually we saw from that is that cases like these are the ones which put us in a situation where children become the most vulnerable at that age of, Avi, remember you mentioned that very tender age, which is very important for us to really protect them, but unfortunately because of the situation like this, and this can be anywhere, this can be in Bangladesh, this can be in Mexico City, this can be in sub-Saharan Africa, the case is fairly similar. So, well, before I go to that, we have discussed about what can be the solutions to improve the safety around that particular primary school. And just to put this in perspective, we have the main entrance right in front of that gate, less than 3 meters from the main paved road itself, and the entry point where 900 students do cross that road. But, for example, this school has more than 3,000 students who have to get in and out every day. So you can imagine the situation there, especially during those rush hours in the morning and in the afternoon or evening when students have to go back home on their way away from school. So my organization, which is working closely with Jurio and Avi and Avi Fear Foundation, we have interventions that we put in place around cities like Lusaka in Africa, but also apart from Africa, we're growing fast, going outside Africa in Latin America, improving specifically safety around schools like this. So let's see what interventions. This is fairly the same angle which we took that other photo, and you commented about a raised pedestrian crossing, for example, very important, because immediately when students get out of school with that traffic flow, you need to really have a very specific location where drivers will know that this is where students cross. That means the understanding and taking precautions will be high. So one of the things that we did, very important, we had to stop that encroachment on the pedestrian crossing so that students and other road users along that stretch of road can walk safely on the paved walkway rather than being forced by those encroaching vehicles to walk on a carriageway, increasing the risk of them being injured by the vehicles which are traveling, as he said, up to 60 kilometers per hour. And mind you, that is very high. And around a school like that, for a child who is hit by a vehicle traveling at the speed of 60, 40, 50 plus, it can be very fatal. It is unaccepted. Indeed, safer walkway, very important, especially in an area like this. A safe school zone is what we think is appropriate scientifically to improve safety for these young children out there. But also we have that safety fencing with bollards, which is very important, also guiding the students at that age to walk along the safer part of the road and come and cross on the crossing point. But also a raised crossing, as I mentioned, important, because at the end of the day, much as these students are young, once they cross at that point, drivers can easily see them, and really they have the confidence at that particular time to cross and feel safe outside their school. They have to go to school. Education is very important for them, exactly. And most importantly is speed reduction. Speed is an issue, especially in areas like this. Areas, we saw the neighborhood, it's very, very dense. We have not only students, but also other road users who have to cross at that particular point every day on their way to and away from school and work as well. So when you have vehicles traveling at that speed, all we're saying is that chances of these students and other kids getting hit and severity of those injuries being high is indeed something that we can all see with our naked eyes. So from the intervention that we put in place, of course, we had speed calming measures, rambo strips, complementing the existing or the raised pedestrian crossing so that drivers can be alert as they approach this particular school or school entrance. As you can see, we have a small pedestrian entrance there, very important, so that they cross directly and walk away from school. So that's important, as I can explain. I've been explaining. We all know once an injury or a case of crash happens at a speed of 30 and below 2015, the chances of that child surviving are very high. And also, one of the studies we did in Tanzania, we saw that around 1.3%, 1.4% of injury cases in the city. And this can be in Gaborone, this can be in Namibia, this can be in Dakar in Senegal, everywhere, which means it is a very public health concern, which requires a lot of attention from us all to put these efforts together to make a difference on the ground. Thank you so much.
Thank you, Thank you, Simon. Can I just ask a quick question, which is, I mean, obviously we're talking about a very high injury burden, as you've said, 1.3% in I think you had a sample size of about 15,000 children, 1.3% injuries in that sample size, which is a very high rate, kind of equivalent to about 1,300 per 100,000 population in public health terms, which is of injury, which is very high. And putting in these measures, as you say, is obviously reduce the level of risk and reduce the level of injury significantly for children. How much does it cost to do? I mean, this looks very nice. The picture we saw earlier, the road obviously looked very, very basic. It looked very dangerous, as you say, with 60 kilometre per hour traffic. But how much did it cost to turn that environment into this incredible environment, safe environment that we can see now?
Thank you, Avi. That's an important question. Yes. So particularly for this school and other schools where we work across Africa, this costs around $20,000 to put these interventions on the ground, control the speeds, and also make way for pedestrians to safely walk around that school there.
And Julio, just a very quick one on how we can spread this generally around. I mean, obviously Simon was talking about other cities where you guys are working, other cities we know around the world where this is an issue, most cities, in fact, where this is an issue. How can we get this out there and get people to be able to do anything about it?
Yeah, so the initial situation in this Justin Kabwe school was assessed with an application that I'm going to maybe to show you here. So this app works. This is just the main screen. So it's an app that is called Star Rating for Schools. It's free to use. We give this application for free with a password to our member organizations such as Amends. And with this application, we assessed this first environment, and we came to many solutions that included these solutions that are now in the current situation. So how can this be spread out? Using, the technology that is available for free, partnering with institutions like IRAP, and it's very easy to do an assessment and to get to this new point. Just want to make a final point that is important. When we talk about speed, especially in front of a school environment, 60 kilometers per hour, this is a sentence of death for a child. There's no way that a child is going to survive at 60 kilometers per hour. So we are talking about the difference between life and death. That's the difference that we're talking about. And we understand that public campaigns, that behavior is important, but also the authorities, the state, the government, they have the responsibility to make safer environments. So people are not going to reduce the speed only because they will have a better behavior. Maybe they are going to get the message, but you have to create safer environments for reducing the speeds. Another figure, just a 5% reduction in speed results in 30% reduction in crash fatalities. Simple. So you need to create environments safer for lower speeds operation.
And one more thing to add on that, we know as children, as young ones, they are prone to making mistakes. And once a child like that makes a mistake simply because she or he runs straight from the school entrance on the carriageway or to the carriageway, what can we do? Once we have a safe environment, what we are saying is that eventually protects or helps to reduce the risk that that particular child faces.
Okay, so just very quickly, just to wrap up the first bit of our session, this is something that's been taken forward by a very strong partnership between Amend and IRAP in many places around the world. They're moving this expertise into low and middle income countries in many other places, and something that we're doing through the wider partnership of the Child Health Initiative for the Sustainable Development Goals. I want to finish this first bit with a very quick film showing you exactly, very, very quickly, it's kind of less than a minute, showing you exactly what happened around this school. And at the end of it, there's a little couple of sponsors' logos that I need to mention because you'll see them popping up, but they're just the sponsors that had enabled this to happen using some private sector support and combining that with government engagement as well. So, and engagement from our international partners. So, just a quick film. Thank you. Okay, moving swiftly on with the second part of our session. I have on my left Tatiana Mihailova, who's the Executive Director of the Automobile Club of Moldova and also representing the Eastern Alliance of Safe and Sustainable Transport working across the region in Eastern Europe. We've got Margie Peden, who's Senior Research Fellow at the George Institute and formerly coordinator of unintentional injuries at the World Health Organization. I've got Prathana Bora, the India Director of Clean Air Asia. And wrapping up our session will be Bright Oiwaya, the Executive Director of ASSERT in Kenya. So moving quickly on to Tatiana, I'd like you to just, I'm going to pass you the microphone, don't worry, in a sec. I'd like you to tell us a little bit about how this can be globalized, really, particularly from your perspective of how this agenda can take hold in places like Eastern Europe, where it's a major development concern.
Thank you, Avi. Hello, everyone. So looking back at this previous presentation and the wonderful work done in Africa, I can say that in my country, Moldova, in Eastern Europe and my East partners in Central Asia, we have the same situation. Our children and schools also are unprotected on roads. That's why such a program, Star Rating for Schools, is applicable for Eastern Europe and it's relevant globally. In Eastern Europe and my country, it was done very much work to improve road safety for young people and kids. For example, we had a very good program, Safe to School, Safe to Home, involved teachers, parents, improved speed enforcement and involved local stakeholders. But we still need work forward, and we still need to protect our children and their lives. We need to cancel all the risks surrounding the school gates. In Moldova, in my country, I can tell you the long and successful history of cooperation of our authorities and national and local government support. But we need all the governments to be engaged and involved, and we'll need more support from the authorities and much more work done through the framework of SDGs. And finally, I want to announce that in East region, in Eastern Europe and Central Asia, in Moldova, Kyrgyzstan, Tajikistan, Georgia, Armenia, Belarus, we would like to implement this wonderful program for children's safe star rating for schools in our country, because we hope for safer, healthier, prosperous and sustainable future for our children.
Thank you very much. Obviously, this is something that we're looking through, particularly focused on injury to children. But we're seeing a situation where the entire environment is just not safe and not clean either for children, particularly as they're becoming more mobile, as they're going out and growing and developing. They're going out into our cities. They're trying to access education and get to school, and they're facing these threats around them. And the added dimension to all of this is air pollution, toxic air on the way to school, affecting millions of children around the world who are living in areas where the air quality is significantly worse than the World Health Organization air quality guidelines. And it's something that Prathana Bora has been looking at with Clean Air Asia, particularly looking at how it's affecting children and young people. So I'll pass on to Prathana to tell us a little bit more about what can be done and what can be done with children and young people engaging on this issue as well.
Thank you, Abhi. Considering the fact that there is no standalone SDG on air, which has always been my grievance, I think I have finally arrived, because I'm talking at the SDG Action Festival. I was at the Clean Air Week yesterday talking about air quality, and we were discussing whether we should be monitoring PM 2.5 or methane or NO2, and I was just thinking that people don't care, because it doesn't matter whether the air quality index is 125 or 100. What we care about is how much it is going to impact us and what it is doing to our body. And that is why I'm really happy to be here, because I think what we need to talk about, whether it's children or us, is the whole relationship with health and how air quality impacts us and our children. I come from a city which has the notorious label of being one of the most polluted cities in the world, New Delhi. And research says that 60% of the children have respiratory problems. And I was sitting at a doctor's place one day and just generally fishing around, trying to find out which doctor is the most popular, and the receptionist told me it's so-and-so because he's a respiratory surgeon, not because he's very good, but because he has the maximum patience and he has newborns who come to him. So we decided to look at air quality from the perspective of children and work with children so that we could integrate issues of health in the air quality dialogue. And one of the projects that we did was in partnership with the FIA Foundation and the London Sustainability Exchange, where we looked at primary school children and brought the air quality dialogue to these children. And we taught them with the help of diffusion tubes to measure nitrogen dioxide levels. The first time that they talked about air quality and a particular pollutant. And after that, the more interesting part was that we asked them to look at solutions, and it was very interesting to see. And this is my favorite part, actually, because children come up with really innovative solutions. They start questioning, and we asked them to conceptualize projects. And it was interesting that one group actually conceptualized the project where they went to the doctors and asked them that how much do you talk about air pollution when someone has a respiratory problem, which is a very interesting approach, because if children begin questioning, I think that's one way where we can begin a dialogue on air quality. And there were other things. I mean, I remember this child who very vocally told me that, it took me 1 month to convince my father to switch off the engine at the traffic light. So advocacy, I think children need to be engaged in more in campaigns. They have a power to convince. They have their own way of doing things. We also like to continue the dialogue beyond the childhood stage. So we also work with the youth and engage with them in terms of creating a mobilization group which can actually talk about air quality to the people on the streets. And that's also an exciting part, because the innovation comes out. So we were developing an app, because data is a huge problem in a country like India, and we were trying to develop an app which would actually bring the information to the local public, to the man on the street. And it was we did a hackathon, and the youth came up with very interesting ideas. And we now have an app which actually has a pledge component. So while you know about the air quality, you also pledge in terms of, okay, I'm going to use public transport, so you contribute. So we are now trying to gather the pledges so that while the government or the policy makers are in denial in terms of air quality, whether it's an issue that requires a priority in terms of policy debate in the country. But if you have, say, 1,000 people who create a dialogue around the whole aspect of air quality and say, we want to do something about it, I think that is going to lead to change. And that is where I think children and youth have a major role to play.
Thank you very much. Thank you very much, Prathana. Over to Margie Peden. In terms of, we talked about engagement, we talked about globalizing all of this, and the kind of global response that's needed from a public health point of view. I know it's something that you've been working on for many years with World Health Organization, but particularly as we've moved into the Sustainable Development Goals now. What can be done? How can we get a focus, particularly on older children, adolescents as well, into the agenda?
Thank you, Avi, and it's a privilege to be here and great to see so many people in the audience. So just to reiterate, Avi started the presentation by talking about that age group 10 to 19, and this really is a critical age group. We have around 1.34 million people that die every year around the world from road traffic crashes, and your 10 to 19-year-old group is around about 120,000. That's a lot of children that lose their lives every year. But deaths are just a tip of the iceberg, I mean, for every child that's fatally injured, there are tens, hundreds sometimes, of children that sustain injuries, limb injuries, as Simon and Julio talked about, children being collided with around schools, traumatic brain injuries. Children are left with significant disabilities, but they also push families into poverty, as Avi said, and not least of all, they push the healthcare facilities beyond their ability to cope. And so we really do have to look at this from an intersectoral point of view. Now we actually have 2 SDGs that mention road traffic crashes. Were you aware of that? So we have SDG 3.6, which is very ambitious and expects us to reduce by 50% the number of road traffic crashes by 2020. So we have a very short time period there. But we do have a grace because road traffic crashes and injuries and deaths are also mentioned in the city's goal and target 11.2 in particular. So we have SDGs, we have frameworks. We have a public health framework, we have a safe systems approach, which the guys talked about a moment ago, of not only looking at the individual and blaming the individual, but looking at the vehicle and looking at infrastructure as well in a holistic sort of way. And then very recently, WHO published a document called Save Lives, which advocates implementing 22 interventions that we know will work. For instance, some of the interventions that you talked about putting in around school, reducing speeds down to 30 kilometers an hour, putting in place speed humps, zebra crossings, other traffic calming measures. Even in vehicles, we know that there are in-vehicle facilities that we can use to reduce speeds. So this document is there and available for countries to put in place. But my appeal is to focus on the adolescent group. This is a group that's historically been forgotten about. And so if you look at health policies around the world, there are major gaps. And there are 1.8 billion adolescents in the world. So we're talking about a big group here. But recently, the Every Woman, Every Child strategy that was developed by the the big 6 health organizations has included road traffic crashes. It had to. I mean, it's the leading cause of adolescence, as we talked about. And the Lancet Commission has also highlighted the need to focus on adolescence and the fact that there are interventions that we can put in place that will benefit adolescents. But what we have to do at this point is actually integrate some of these strategies that have been developed, the Every Woman, Every Child, the Lancet Commission, the Save Lives package, integrate them and make this a global priority. The thing about road traffic crashes and prevention is that it's intersectorial. So it kind of falls between the cracks very often because health says, well, it's not our primary priority, but we see all the injuries coming into our hospital. Transport perhaps has other priorities than road safety. So we really do have to have an intersectoral approach to it, and we have to integrate primary and secondary prevention into adolescent-friendly health facilities for children. So it's a complex problem, but we do know of ways how to prevent this. We do have to look at not leaving anyone behind, and I truly believe that this is a group that we really need to focus on. We've got to utilize technology better. They were talking this morning in the opening session about technology. We have to have an individual response to this, and I think that's where many of the technical advances that are being made can come in. And we have to balance that with community, government, and a multi-sectoral response.
Thank you very much. I'm going to open it up very briefly to questions from the audience. Anything you'd like to ask or say? I think there's an SDG kind of box here that I've got to throw to you very carefully. Don't want to hurt anyone, but you should be able to talk into it, if it works. Yeah.
Thank you. I am Virendra Kumar from India. I come from Delhi. I'm leading an organization called Global Network for Sustainable Development. I don't have question, but I want to add something in panel. We discuss about traffic and air pollutions, but mobile technology, I am talking about technology, Even mobile reductions is a big problem, especially in developing countries. We do have rule regulations, but many times we can see mobile tower is just beside school premises. In residence area also mobile tower is there. When we are talking, most of people are using mobile. When we are talking, we are getting a lot of radiations. And same time, mobile tower is creating a lot of problem. We are losing birds because of mobile tower and radiations. And same time, children are getting problem of mental health, and that need to address. What solutions we found? We are making, establishing Peace Club for Sustainability around the country. At the moment, we have 3,000 schools. We started operations last year only, but till date, we have 3,000 schools in our network who are going to establish Peace Club for Sustainability. And what exactly we are doing? We are training children on SDG, and same time converting that training into action through 4 different seasons called Season for Peace and Non-Violence, Season for Earth, Season for Human Services, and Season for Interfaith, Interculture. So we have to use technology for our growth, our opportunity. Same time, we have to see technology should not destroy our life, and all development should be sustainable. Thank you.
Thank you very much. Any other comment, questions? Yeah. I'm not going to throw it.
Thank you. My name is Abu Nawar. I'm from Jordan, so you can realize which part of the world I come from. Yes, we can put pavements, we can put bridges, we can educate the children how to protect themselves. We can work on obstetric emergency care to make delivery safer. Yes, we can do that. But tell me, in the name of God, how can you teach a child to protect self from shelling? Nuclear debris. Development is only one side of the coin. Leaving no one behind by bridging the disparities is part of it. Peace, respect, humanity is the other side of the coin. One hand cannot clap. Thank you.
Any further comments? Quickly, yes. And then I'll move back to...
My name is Paras. Basically, I want to say about the child rights. There's a lots of gap if you are measuring according to the SDG around the world, especially in the Asian countries and African countries. There are lots of children that living with lack of people's basic rights like education, nutrition, immunization. We implementing the universal immunization program across the world, but the access and reach of this program is basically in the poor and remote areas very poor. So we need to focus more on the deprived and vulnerable community across the world in the different countries. Much of people is still living in the helmets, living without roof around the world. They have no access of proper water and sanitation, health and immunization. And millions of children suffering with these issues across the world. Thank you.
Thank you. I had a question to the left.
Yeah, actually, hello. Actually, what about the role model you have created in Africa in one of the school? what do you think? This is not the common situation for all the schools? If it is common situation for all the schools, why there is a need of a role model to be created in one school? As you are working very closely with the UN, WHO and all, and WHO and United Nations, sometimes they are creating this like polio vaccines and this and for the health issues, for everything they are helping the governments. Why don't this UN and WHO coming out with such guidelines that this is a safe school zone and such things should be created in front of each school, like every school is having a roof, walls, gates and everything. Then why not the infrastructure in front of the schools? So why this UN and United Nations and WHO coming out with the particular role model things? This is the proper infrastructure should be created in front of the schools. At least I think then the NGOs can fight very well. Instead of creating the role models for one or two. I know, because there are lacks of problems in front of the governments. Maybe the lack of the funds, maybe lack of the knowledge also. If we are creating them just in one school or two school or five school, and what about the rest 98% schools?
Okay, it's a very good question. Okay, so what we're going to do is we're going to comment a little bit on some of the issues that have been raised just now. We'll go back for some more questions in a minute. I think, obviously, we've heard comments on technology and issues to do with technology that also need to be addressed, mobile technology, questions on and comments on huge issues of war and violence and the effect on children that need to be addressed, particularly through peace and humanitarian action, and a question on why, this can it not be adopted universally across all schools, and then why isn't there being the focus on all schools in this agenda? So I don't know. Can my panel maybe we'll go through and see if you can touch on any of those issues. I also could make a couple of comments as well, but I'll go over to the panel just at the moment. You've got your mic. Good.
Do you want me to start?
Yeah, go for it.
Okay, great. Great questions and great suggestions. I think that it is really important that when we develop programs, we develop these programs with young people, with adolescents. And we sit down in a multidisciplinary way and we look at what are the priorities and what are the possible knock-on effects. And I speak to your issue of radiation, the issue of peace. So it is really important to talk to the stakeholders, so the adolescents in this area. I use just one example. We've talked about traffic calming, for instance, and yes, it's very important to calm traffic around, particularly areas where there is potential for conflict with pedestrians or other vulnerable road users. But my colleague sitting on my left here will tell me that the moment you put a raised zebra crossing in, or a hump or a bump, cars are going to change gears, they're going to emit more fumes, and so the air pollution is actually going to get worse. So this is an example in a situation where you would have to sit down and prioritize what is it that you need more to keep the children safe in this area. Can you forego the little bit of increase in air pollution? Can you manage to deal with air pollution somewhere else? So this is why I think it really has to be a multidisciplinary approach to the problem. And then speaking to your point about why can't we actually put this in all schools? As an academic, I speak now, I need the evidence first. So I look to organizations like Amend, like IRAP, like the Botnet Challenge, which are also doing this in about 12 different cities around the world, to give us that information first. And once we have that information, we can pass it over to WHO and to the other UN organizations and say, okay, now let's come up with a package that hopefully can then be rolled out to all schools around, much the same as a vaccine gets rolled out. So we're going through the same rigorous process.
I think, and to add to that, I think on the final question, You know, obviously it's something that should be done around every single school globally. I mean, there is absolutely no excuse, there can be no moral justification for having a situation where children are walking to school and facing traffic of 60 kilometres per hour that is going to kill them. There can be no, I mean, and it's well known what the solutions are and what their benefits can be. The data on all of that is out there, is you know, starkly apparent. Governments aren't responding as they should be. It's an area of sustainable development that is not being addressed within the sustainable development framework. Donors are not responding as they should be either, which is comes to Margie's point earlier about the big strategies for the sustainable development goals. Every woman, every child. You know, hundreds of millions of dollars of funding going into child health, which is quite rightly as it should be, but nothing going in globally on these issues, which is why we see a situation where so many schools globally are not having these kinds of vaccines put around them to ensure children can access education safely. I can see some hands, I think, going up in the audience, so maybe I should take a few more questions. There was a gentleman at the back there. We have our boxes are going. Yeah, fine, thank you.
Thank you very much. Taking the opportunity of this sitting, I just want to take your attention towards the girl child's abuse and the girl child rape. I mean, this is Ilyas from Pakistan, and my organization is Chanan, and we are working for the youth and women over there. And if you people could see, there are a lot of cases which are happening in Pakistan in different areas of girls' child harassment and even rape cases for girl childs and boy childs. So this is I think, a good platform to discuss these kind of issues, and we have to put the attention of UN as well as these kind of platforms to work and think about those kind of groups and those kind of children who are suffering these kind of issues. Thank you.
It's obviously a very important issue and something that lots of partners of ours as well, are focusing on, and there needs to be a lot more attention on. An interesting area that we've started collaborating on is with UNICEF, that's been looking at child violence, child protection globally. And it's interesting that it's the child protection colleagues of ours who are also collaborating on this safe environment issue as well. And there's clearly benefits that cut across all of this. You know, if we're addressing policies that are looking at safe environments for children in general, we can address issues of violence, issues where children are vulnerable outside of school, alongside these other issues that we're looking at outside of school as well. And too often there hasn't been a focus of the wider impacts on children who are trying to access education. So it's one of the interesting areas where there's some useful collaboration beginning to start. I maybe would just, if there aren't any further comments, questions from the audience, yeah. One more.
Sure.
I'll give you this. It's easier.
My just query, one single query. Like if we divided the world into the two parts, developed and underdeveloping phase. I'm just dividing the world into two pieces. One is the developed world and another is the developing world. Do you really think the history which you are having in developed world, it's a 60 years, 70 years, maybe 80 years? Like the traffic sense, I think it has not been developed within a day in European countries or American countries. I think it has taken around 60 years. Do you think this developing world will create this model within 2 years, 5 years, 10 years, 20 years, 30 years? In continuation of a lot of the problems with the neighboring countries and the business and the money and everything, do you really think this goal, 2011 to 2020, would it be successful, even at 2% or 5% or 10%, in case of developing world?
I'll pass on to the audience for this, although I won't completely shirk the question. I mean, you know, obviously it's a very ambitious target. You probably have seen it in the SDGs, target 3.6 to reduce road traffic fatalities by half by 2020. So, you know, clearly the majority of developing countries, rapidly developing countries, are not going to meet that target, and it's something that needs to be addressed. As Margie said earlier, there is the other target to 2030 on road safety in Goal 11 as well. But it's something that there needs to be far more support. You know, obviously there's a high rationale for increased action if we're going to make any progress going to 2020, and part of the idea of having a target is to really mobilise action. So that's what we're talking about here at the conference today. So clearly needs to be more action mobilised, and then, you know, to look at what can be done going through from 2020 to 2030, the duration of the goals to help countries really make some substantive progress. I'll ask, first of all, two colleagues on the right, just very quickly, to talk about what they see, and also what they want from the development community in order to see progress on this, and then we'll go over to my colleagues on my left, and then finish off with Bright Oiwaya in a minute. But yeah, just how are we going to make progress on this?
Yeah, first of all, the infrastructure plays a very big role on this. As I said before in my presentation, the behavior of people, behavior of children is obviously very important. But as my colleague Simon said, people make mistakes. So every day when you have a situation like in this school where 900 children are crossing the street, plus vehicles driving at 60 kilometers per hour, the combination of these two things is really dangerous. So you need to create a safe environment. And as you were saying, maybe the goal should be every single school around the world should have a safer environment, as simple as this. So we are working in partnership with the FIA Foundation, with AMEND, with other partners to provide tools to assess the environments and the infrastructure to make this safer, because safe infrastructure saves lives.
All right, thank you, Julia. For me, I think it's one of the things that we are trying to push forward now is really to advocate this to the government, so that as you know, as an NGO, going to every single school is such an ambitious target. However, involving local government, central government in areas where we work, giving them a reason to see that indeed these cost-effective measures, interventions can be done, can be put in place. Scientifically, we have seen the data that support the improvement that they provide in terms of reducing the risk around areas. And someone mentioned that, of course, governments have priorities, they have things on their table to work on, but as we keep on pushing them, giving them reasons to see this as an issue that requires attention. Of course, WHO and these organizations coming in, really, I think that's a way forward, not only for civil society, but really indeed involving local and governments is important. Thank you.
I'll throw the box or the ball over to the colleagues on my left.
I wanted to mention too, we said many words about local government and national government support. I have to the audience a question. Do you have national road safety strategy in your countries? Can you raise the hand? No. National road safety plan? Okay. So when we're speaking about the support from the United Nations, WHO, and or the global community. We should have our own strategy so that to show to the global community that we are ready to implement and to save lives. And it should be all the stakeholders like NGO I represent, because I am the member of the National Road Safety Council, and the civil society has the voice in this council. And believe me, when we are going far to the left or to the right from this strategy, the road crash victims are rising up. This is my experience for 10 years. That's why I think national strategy, national approach and national will should be shown to the global community so that to be supported in this each school safer and sustainable. This is my point.
I'd actually like to emphasize the role of partnerships in this debate, and I think it's important that we learn from each other. And a simple example I'd like to give in terms of, I like to quote this example because it again reiterates my faith in children. And you know, the project that we did, which involved primary schools, and it basically also involved an exchange. So there was the school in India which had worked on the same project in terms of measuring NO2 levels and looking at action, and then sharing it with another school in London which had gone through the same exercise. And the sharing was very interesting because the children in London had great faith in policy, and they talked about air pollution solutions from perspective of policy interventions, while the Indian children spoke about individual action and what they could do. And it was learning between the two countries and the two people. And what I'm trying to emphasize is these are global problems, and we have our own individual solutions. And sometimes I think sharing actually strengthens the solutions, and we should actually have a positive outlook, because the complexity of environmental issues is not just environmental. We cannot forget the economics or the social or the cultural aspects. So it's important to also understand that there is a lot that we can learn through partnerships, and that's one way in which I think is the way forward. So if you look at even the SDGs, there are so many SDGs. If you look at the linkages, for instance, when we talk about air, I started my dialogue by saying that there's no standalone goal on air. But if I really want to take up SDG action for air, I could look at goal 3, which talks about reduction of respiratory diseases. It talks about road safety, walk to school, and things like that. I can look at goal 11, which talks about creating safe, inclusive, resilient spaces for people, which includes children. So how do you create a space for children? And then similarly, it talks about reduction of PM 2.5, which is a direct intervention. So I think it's also about identifying entry points and seeing where maximum impact is. And as a sustainability community, that is a challenge that is ahead of us in finding the linkages and establishing partnerships.
Thank you very much. Did you have one? We had one final comment from our panel, and I think we'll go to one very quick question after that. I can see somebody has a burning question, but it would have to be very, very quick before I move on to Bright to wrap up the session.
So I'll be quick, but I'm probably the only medic sitting around the table, sitting around the panel here. So I do also need to make an appeal for what we call the post-crash phase. So no matter how hard we try and work on primary prevention through some of the interventions that we've talked about, infrastructural improvement, vehicle improvements, and individual behaviors, there are always going to be children and adults, for that matter, who are injured and end up in our hospitals. And so we really also have to look at that pre-hospital phase, that critical phase between the crash and getting to an appropriate facility. And then through trauma care into a rehabilitation phase, so that we can integrate people back into society so that they can become, they can be invested in society. And the gross national product, which is between 3% and 5%, I think, that countries lose, can be reduced. So that post-crash phase is also critical.
Thank you very much. One more quick comment, from over here. I will get this to you.
Thanks for this. My name is Rajat. I'm from Chintan. It's an environmental NGO in Delhi. We focus on waste management. We run learning centers for children, for waste picker children and children of waste pickers. One of the main challenges that we face is that we have limited resources, and I think most non-profits around the world have limited resources. So there are only so many children that we can cater to. My question to the panel is that in the absence of a lack of resources in most developing countries, how do we actually build partnership for goals? Because we talk about partnership for goals, but we don't see partnership for goals. So how do we get around that?
It's a very good question. I'm going to have a very quick go at it. I'm also going to see what the panel can say. But I would say, you know, looking behind you is the Child Health Initiative. Now, we're a partnership for the SDGs. We're a partnership that operates in an environment that doesn't have much in the way of resources compared to other big public health issues, and operates in countries that are lacking funding and lacking resources. And we aim to catalyse responses. You know, we go in on the ground. The initiatives here that we were showing before, we're talking $20,000 for a school. That's $20,000 that keeps 3,000 children safe, that also serves an entire community, that reduces fatalities and injuries hugely when these interventions go in, and also has benefits in terms of poverty reduction and air quality, and just access to education generally as well, multiplier benefits on the whole initiative. So we're not talking about necessarily huge amounts of money for some of these interventions. They're initiatives that can be done if a lot of the time there is the coordination, the political will to put them in, which is often lacking. And without the kind of global funding, as we were hearing from the questions earlier, you know, this isn't done around the majority of schools, so many schools in low and middle income countries, and road traffic injury in general. The response isn't adequately carried out in many places without that coordinated global response. So that's what I would say very briefly about partnerships. I don't know if anyone else has anything quickly to say. If not, we'll move on to Bright. Ooh.
So you asked about the partnership. In my country, in our capital, we have a very good partnership called Occupational Road Safety. This is more for fleet management, but we also work with the children, and a business company is involved, maxi taxi, like public transport is involved, trolley bus company, NGO, Automobile Club of Moldova, and Mayor Office. And we are working to implement road safety policy in each institution involved. And we are asking other companies to join us and to implement such road safety policy focused on fleet management, but for safety in cars and on streets, involving children and other passengers and pedestrians around the city. So this is a very good partnership, because this last year we got the Prince Michael Award. So this is a very recognized international award for road safety, because this partnership is living like 5 years, and we have very good reduction of the public transport in our capital.
Okay, we're going to have to wrap up the session in a few minutes, but the last word is going to go to Bright or Wire. We heard earlier about, you know, that phrase that we often hear with the Sustainable Development Goals, that we're, you know, focused on making sure we don't leave anyone behind. And Bright's experience in Kenya and what she sees with the children in Kenya shows that we are leaving people behind. People are being left behind, and there needs to be much more focus from a public health and from a poverty perspective, from a sustainable development perspective generally, as Bright will tell us. Thank you, Bright.
Thank you, Avi, and thank you, everyone. Your contribution is very valued, and thank you, panel, for a very engaging session. As you will notice that the panel has focused mainly on safe journeys to school, and I believe that is important because it helps concentrate a wide range of partners into focusing on protection of children and also looking at the wider issue of sustainable development. You know, road traffic is out of control in many of our countries, and I'm sure many of us can attest to that, and especially from the developing world. This is one part of development that should add value, but instead a lot of people are being killed and injured on our roads. I will tell you my personal story. I was involved in a road crash. I was a banker, I was going about my business, and one day, on a main highway in my country, Kenya, we had a head-on collision. Hit from the front, and the car behind us that was speeding hit us from behind. Sandwiched between two vehicles, I was sitting at the back, well-belted, doing the right thing. We couldn't swerve to the shoulders because they were ragged. So we watched, closed our eyes, and there it happened. We were hit. I injured my spine. But what followed was more of the nightmare. We were at a place where emergency care and post-crash care that Dr. Maggie Peden has so ably talked about was not available. So we came from a small hospital where we were first admitted, tried to get help through evacuation by an AAR, where we come from, the AAR ambulance services. It didn't happen because it was raining so hard, there was visibility problems. Back again to the small hospital. Please note I'd injured my spine. And I injured my spine because of the impact and also as people were pulling me out of the vehicle. I was belted. So it was double injury. We took about 10 hours to get to a proper hospital with proper medical attention. And this cost me, from that point forward, to enter the group or the sector or the statistics that are normally considered as very vulnerable road users. So what makes me so vulnerable? Well, of course, I'm seated in a wheelchair, as you can see, and I've been seated for the last 20 years. But mostly, it's the roads that I have to navigate in my country that have no provision, to the most part whatsoever, for anyone that uses a wheelchair like me. No walkways, no crossing designated places. And most disheartening is that our little children in my country have to go through what I go through every day. They go through this while going to school, trying to get an education, which is a very basic right for any child in any part of the world. More sad is that the fact that some of them don't go back home. They are killed. You saw from the presentations that sometimes the roads are right outside, the schools are right outside the highways. Some are killed, and some are injured, and some are permanently disabled like I am. And it's not just the road traffic injury that is a threat to our children. It is also the fact that they are forced to inhale the fumes from the most unroadworthy vehicles sometimes that we find on our roads. And so hospitalization out of road crashes and out of ailments that are acquired from air pollution sometimes cause children to miss school. They miss the very basic right to education because of that. And this also makes poverty a reality, because most of these parents are living in situations where they have $1 a day, they have $1 a day to spend. So they divert the monies to hospitalization, then other things will suffer. So efforts to implement some aspects of the SDGs by some of our organizations in my country were surprisingly hit by snags. We wanted to pass legislation to reduce road speed limits around schools. It took us 3 years to get it through Parliament. And guess what? It is us, the adults, that pose the arguments. Should we slow speed around schools? Is it important to protect our children? That's what we're basically asking. Should we protect our children? So should we be the ones that ask these questions? or should we be the ones that go ahead and protect our children? And many people, just like in Kenya, are suffering and thousands are being killed on our roads. So this is a very important SDG issue, if you ask me. It should be the heart of sustainable development. Whether you're talking about health, whether you're talking about agriculture, whatever you talk about, transport is an issue. So it must be at the heart of SDGs. I have campaigned at the UN since the time the SDGs were being negotiated about 4 years ago, and it looks like I have more campaigning to do because we have achieved some things, but a lot more is yet to happen. But we must start with our children. As this session has shown, we have seen what IRAP and AMEND have presented. We have the solutions, and they're not very expensive solutions. They're things we can do. They're things our governments can adopt and do. So our leaders must now take action. They can't leave this to the little NGOs that are mostly not funded to take the lead. Our leaders, our countries must take charge of this and to make sure that there is funding that is able to sustain such interventions. So I urge all of you in here to sign up to the Every Journey, Every Child campaign. And this is focused on air quality and safety. Let's give every child a safe journey and a healthy journey to school. This is the promise, I believe, that SDGs must deliver. Thank you.
Thank you very much, Bright. Very powerful words. If you want to go onto the campaign, it's at everylife.org, I believe is the best website address, everylife.org. It's quite simple. And thank you very much for attending and participating in this session. And, you know, we're all available for any further questions and discussions that you might want to have with us throughout the conference. But thank you very much.